Good afternoon, and welcome to our virtual program, Healthy Weight, Healthy Lifestyle. We're very grateful to have Dr. Michelle Maresca and Dr. Marianna Nicoletta-Gentile with us today. Dr. Nicoletta is a pediatric oncologist who provides specialty care for multiple acute and chronic endocrine disorders. This includes diabetes, pubertal development, growth and thyroid disease. She does have a particular interest in obesity and weight management, as well as type 2 diabetes. She works closely with a team of nutritionists and diabetes educators to provide the best care for her patients who may be struggling with weight or their diabetes management. In her spare time, she enjoys doing activities with her family and kids and cooking new recipes. Dr. Michelle Maresca received her undergraduate degree from Villanova University and her medical degree from Robert Wood Johnson Medical School. She completed her residency in pediatrics, followed by a weight management fellowship at Numerous A DuPont Hospital for Children and fellowship in pediatric endocrinology at Columbia University. She's also board certified in obesity medicine and served on the pediatric committee of the Obesity Medicine Association for the past 3 years. In her spare time, she enjoys singing, running, and being a mom of 3 kids with a lot of personality. So at this time, I am going to turn it over to Dr. Nicoletta.
Good afternoon, everyone. Thank you for joining us today. So I will get started on our talk today. So what are the benefits of healthy eating? So some benefits are better school performance. So children will certainly have better concentration with certain foods that they eat. Definitely for growth purposes, a good source of calories is important for how children grow and how they develop. Also preventing obesity, which has become a concern over the last few years in our children, both children and adolescent age groups. And prevention of chronic disease or maintaining chronic disease. These are all benefits for having a healthy diet. So when we eat, we are eating most of our food is comprised of carbohydrates, proteins, and fats. And we need all of these things in order we need it for energy. So all of these 3 things will metabolize into energy. So it's important to have a balance. We need carbohydrates, proteins, and fats to build muscles and cells and compounds in our body. And if you look here, I know this slide may seem a little confusing, but if you look at the carbohydrates and the fats, that's what leads to the excess calories. So this is what leads to increased energy stores. This is what leads to weight gain. So there's a certain balance that we want to make sure that we have in our diets for our children. So how do we gain fat? Fat comes from the calories that we're taking in. And if our calories out are not equaling the calories that we're taking in, and calories out comes from physical activity, any physical activity, then that's when we get the weight gain. Now, this would be the opposite for children who are trying to gain weight. So we want more calories in than calories out so that they do have the weight gain. But some kids are just, very active and they may not be able to have this balance. So just for example, 120 extra calories a day is equal to a regular can of soda. So just having a regular can of soda every day can lead to 1 pound of weight gain per month, which can lead to over 12 pounds of weight gain per year. Now, of course, this would change depending on a child's weight and age group and all of that. But even when we talk about calories out and physical activity, just walking briskly for 20 minutes can burn up to 120 calories, which can lead to 1 pound of weight loss per month and about 12 pounds of weight loss per year. So there's little changes that we need to make, whether it's gaining calories or losing the weight. there are ways to manage that. When we look at portion sizes, so portion sizes have certainly changed over the years. 20 years ago, a bagel looked much different than what a bagel looks like today. It's nearly doubled in calories and doubled in size. So this is certainly a trend that we're seeing across things, even with, fast food chains. Things are supersized, and you're getting a better deal if you buy the larger portion. So this is certainly a trend that we are seeing across the stages, which seems more appealing to families. So what's normal weight gain? Normal weight gain in an infant is between 5 to 7 ounces per week. You want to double that birth weight by 5 months and triple the birth weight by 12 months. The average weight gain is about 4 to 7 pounds per year until puberty. And I'll have Dr. Maresca take over now.
So when we talk about weight, it's important to take into account height as well. Someone who's very short may have a weight that seems very low, but it could be appropriate for their height. And similarly, the same is true for someone who's very tall. So the body mass index is a way to determine if the weight is appropriate for height. We calculate the body mass index by taking the weight in kilograms and dividing it by the height squared, or meters squared. There's a wide range of what's considered a healthy body mass index. Below the 5th percentile, or the 5th percentile and below, is considered underweight. The 5th percentile to the 85th percentile is considered healthy weight. And the 85th percentile to just below the 95th percentile is considered overweight, and the 95th percentile and above is considered obesity. So while there is a very large range that is healthy, it's also important to take a look at how the body mass index changes throughout the lifespan. So infants and early toddlerhood, they tend to have a little bit higher BMI, and then they actually get thinner. Between ages 4 and 6 is when kids tend to be their thinnest relative to their weight relative to their height. And then particularly as they start entering into puberty, they tend to gain more weight relative to their height. When the BMI is in an unhealthy range, rather than getting to a specific number goal, because I get asked that question a lot, remember that there is a wide range of what's considered healthy, but even more than necessarily starting by getting into a healthy range, the initial goal may just be improvement in BMI or even stabilization. Next slide. The studies show that health risks increase when BMI is below and above the healthy range, and it's a lot easier to track and measure weight and BMI than it is anything else. However, we want to avoid putting too much emphasis on weight because this can lead to negative self-image and even disordered eating. From a pure weight standpoint, having extra weight does put extra stress on the joints, but beyond that, really the main concern is health, which is not necessarily represented by the number on the scale. For instance, muscle weighs more than fat does. So a child who is very muscular may have a BMI that's on the high side, but that does not necessarily mean that they're at risk of having health complications. We want to have a happy medium when it comes to weight gain with respect to growth. If you have too much weight gain, that can actually lead to earlier closing of your growth plates and stopping growing earlier, whereas not enough weight gain, and that will lead to not good linear growth as well. Next slide. We're often asked the question, how do I get my kid to eat vegetables? In general, parents often wonder how to get their kids to eat a healthy and varied diet. One of the most important ways is to start early, even from infancy. So in full disclosure, as I said, I have 3 kids and they actually eat pretty well. So I'll share some tips that I followed, but I also say this acknowledging that I know that I'm pretty fortunate and we're all in different situations. I chose to start with breastfeeding because typically the first food that a newborn is exposed to is breast milk, which is technically colostrum at that point, or formula. Breastfeeding isn't always possible, but if you have the ability to breastfeed, there are a number of health benefits to both mom and infant. And studies have shown that there's a decreased risk of obesity in children who were breastfed as infants. It's thought to be due to a number of factors. One is introduction to different food tastes. So the food that mom is eating can influence the taste of the breast milk. So they're exposed early on to different tastes. The composition of breast milk also better fits an infant's needs. It has less protein and fat than formula does, and it contains substances that help regulate appetite and fat cell development. And then finally, infants who are breastfed are able to self-regulate their intake. Notwithstanding that there are some women who struggle with supply, which goes beyond the scope of this talk, but in general, as long as mom has a healthy supply, the infants are able to self-regulate their intake. Once complementary foods are introduced, and really at all stages of life, juice is one thing that I often focus on. Juice has minimal nutritional value. You basically squeeze the sugar and the water out of fruit, and it typically just adds extra calories to the diet. Yes, there are some vitamins like vitamin C, but you can easily get enough from eating whole fruit. Drinking juice early on can lead to preference for sweets, particularly sweet drinks, and can also lead to dental cavities. But if you start kids out with a habit of drinking water, it will stick with them. And then when it comes to introducing solids or purees, I recommend introducing veggies before fruit so they gain an acceptance of food that isn't super sweet. They may not be huge fans at first. I know mine weren't necessarily huge fans at first, but if you keep trying, they will accept it. Personally, I tried to introduce as many veggies as possible before introducing fruit, and I avoided the veggies that were mixed with fruit so that they would accept veggies as is that weren't sweetened. And it may take up to 10 to 15 exposures before a child will accept a new food, so don't give up. There's also evidence that the more exposures they have before 12 months of age, the more likely they are to accept a variety of foods and to continue to eat the foods they were exposed to prior to 12 months of age. A systematic review found that the practices that were best for promoting vegetable acceptance were exposing them to a different vegetable on a daily basis, and then re-exposing them to the same vegetable after a few days. And now I will turn it back to Dr. Nicoletta to review more tips for healthy eating.
So one of the things that I like to refer to, which is pretty simplified and easy to understand, is my plate. So you might have come across this in your pediatrician's office, but this is something that you can look up on the internet, choosemyplate.gov, and it's really a balance of how we should all be eating. We are answering some questions did come through. Some of these questions are answered in our slides, but one of the things is really how to balance meals. And referring back to vegetables and introducing vegetables early on, half of our plate really should be a vegetable or a vegetable and a fruit. The other half is split between starch and proteins. So again, reinforcing, introducing those vegetables and really trying on a daily basis to get them to try new vegetables so that most of their plate will eventually be vegetables. The reason why we have this My Plate is we want energy balance. It's a good way to, this resource is a good way to show you the foods that we need to decrease on and the foods that we need to increase on. And it really reinforces nutrition guidelines across all age spectrums. These plates are, can be easily found on Amazon. And it's a good way to just show kids and teach them how they should be eating. What's also helpful is the 5-2-1-0 rule. So 5 or more fruits and vegetables, 2 hours or less of screen time, 1 hour of physical activity, and 0 sugary drinks, more water, low-fat milk. These are just some guidelines that are sometimes helpful in what we should try to aim for on a daily basis with our children. And back to Dr. Maresca.
Sorry. As we mentioned previously, juice and other sugary drinks should be avoided, but is it okay to give drinks with artificial sweeteners like Crystal Light and diet soda? Are they any better? The truth is, not really. Artificial sweeteners can affect the types of bacteria that live in your intestines, known as your gut microbiome, and this can actually worsen insulin resistance. And insulin resistance can not only affect your health, but it can also make it more difficult to maintain or lose weight. It also affects your taste preferences. So when you're drinking something that tastes sweet, you tend to keep craving things that taste sweet. But also when your brain is getting the artificial sweetener, it gets the sweet taste, but without the satisfaction of sugar, and then tricks your body into wanting even more sweets. So generally, artificial sweeteners are safe, but if possible, we'd recommend avoiding them. Next slide. Changing gears a little, there's other aspects to a healthy lifestyle besides healthy eating. Physical activity is especially important. It helps to promote muscle and bone strength, balance, flexibility, endurance, increase energy, improve mental health, concentration, and sleep. While studies have shown that physical activity alone does not typically lead to weight loss, insufficient physical activity can definitely lead to weight gain. We've all seen this over the years of the pandemic when kids weren't in school and all of the sports were shut down. They weren't getting the typical physical activity that they get, which is the primary source of their physical activity. And we all saw a lot of weight gain during those years. Physical activity also helps to improve metabolic health and decrease risk of diabetes independent of weight. So how much physical activity do kids actually need? So keep in mind that physical activity includes all the movement they get throughout the day, including gym class, recess, walking to and from school, and playing. And for the younger kids, playing is the bulk of their physical activity. In general, about an hour a day of physical activity is recommended for most kids. And then additional unstructured physical activity is recommended for all. As they get older, we recommend incorporating moderate to vigorous intensity in their physical activity. And we also discourage extended periods of inactivity or sedentary time. Next slide. So sleep and screen time are other healthy lifestyle factors that are important not to overlook. Also keep in mind that sleep quality is important, and ideally sleep should take place at nighttime for school-age kids. A lot of kids are tempted to nap after school and then they wind up staying up late because they can't fall asleep. Additionally, if your child has heavy snoring or pauses in their breathing while they're sleeping, they're likely not getting restful sleep, and this can put them at risk of other health problems. So talk to your pediatrician if you have any concerns about their sleep. In general, the older you are, the less sleep you need. So while an infant may need 12 to 16 hours, including naps, a teenager can get by with 8 to 10 hours. Screen time is another battle we have as parents. From personal experience, I can say that the pandemic has made things even worse because they spent so much time on screens, they've really become addicted to them. And it's true for all of us. How often do we scroll through our phones when we have a minute of downtime? So why is too much screen time a problem for health? It can lead to less sleep, especially if you're staying up late on your screens. So some suggestions I have to help with this are to avoid keeping the phone in your room at night when you're sleeping. And particularly for younger kids, avoid putting a screen in their bedroom. Screen time is also typically time that doesn't require a whole lot of movement, so it doesn't burn a lot of calories. Even though we typically think of physical activity as exercise, it does include all the movement throughout the day. So the more time you spend on screens, the less movement you do and the less you burn. So what are the official recommendations? We usually say to limit screen time to less than 2 hours, but the American Academy of Pediatrics actually recommends limiting further to 1 hour or less a day of screen time that does not include schoolwork or homework. For toddlers and infants less than 18 months, it's recommended that they only use screen time to video chat with relatives. Now, as far as limiting the screen time, practically speaking, it's not always possible to adhere to these limitations. So a realistic recommendation would be to try to reduce the screen time. And now with phones which track screen time, it's a great way to measure your progress, particularly for older kids who spend the majority of their screen time on their phones. And now I'll turn it back to Dr. Nicoletta to review some potential health complications of having too much weight and signs to look out for there may be a concern.
So what are some of the complications with weight gain? So without getting too far into this, we'll touch some of the basic things, but certainly with weight gain, psychosocial is a huge part of this. So some kids may feel depressed. Some kids may have a poor self-esteem, particularly we may see this in like preteen, adolescent years. And eating disorders may develop. So when is it too much? When is it too little to enforce these things? So we definitely want to have that healthy balance and remind families and remind children that, it's about being healthy. That's what we're concerned about. It can affect the pulmonary system. So like referring back to Dr. Maresca, if there's some signs of snoring, that could be, or pauses in sleep, that could be a sign of sleep apnea, which may be related to excess weight gain. Some children have significant asthma that may affect their ability to move or to exercise or to go outside. So these are definitely things that can develop with weight gain, or if there is exercise intolerance related to asthma, sometimes it's difficult to get them to move. It could affect the cardiovascular system, so hypertension, high blood pressure. It can cause elevated cholesterol or triglycerides. It could affect the gastrointestinal system, so something like fatty liver can develop where it may affect the morphology of the liver and liver enzymes. It can certainly affect the endocrine system. So in the development of type 2 diabetes, which we are seeing it in younger children more and more over the years. It used to be just thought of as an adult disease, but we are seeing it in younger kids. And the younger that children develop these type 2 diabetes, the more complications they may have as an adult. It certainly can affect puberty, whether it's advancing their puberty or delaying their puberty. It could affect growth plates. So it certainly has a lot of excess weight gain, certainly has a lot of effects on the endocrine system. And then musculoskeletal, just overall, just joints, their hip joints, their knees. They may have difficulties in moving around just because of their joints and carrying around this extra weight. So what are some of the warning signs? So certainly if there's a continued weight gain and there's no growth, that's concerning. If kids are gaining lots of weight, but they're not growing, that is something you want to bring about to the pediatrician. And your pediatrician, they recommend further testing from there. Or if there's a child who's losing weight and is not growing, that's also a concern. Other symptoms that may be associated with weight gain is increased fatigue, if there's hair loss, dry skin, if there's very excessive weight gain, if even with weight loss, if there's children who have increased thirst, increased urination, these are all things that should be brought to the attention of your pediatrician. And certainly any abnormal blood work. So some pediatricians may do annual labs that are looking for various things, whether it's a thyroid condition or blood sugars or things like that. And that may be something that might need to be referred out depending on the blood work. So what are the tips? Encourage your children to eat breakfast every day. I know this becomes, even with my own kids, this becomes difficult to try to get them to eat something, but it's really important to try to get them to have something that is, fairly healthy. Lots of breakfast foods tend to be more carb heavy, so like pancakes and French toast, cereal, but even if you can incorporate some sort of protein with that, so whether it's a glass of milk or yogurt on the side, if they're eating 2 pancakes, maybe they can have 1 pancake with, that other source of protein. Aim for regular meal times and eat with your children. Again, this as a mom, this does become difficult. Just getting dinner ready on time, especially when kids have lots of, activities going on after school. This certainly becomes difficult to do. But even if you can try to manage to do it 2 to 3 times a week, this is certainly a time where you spend time as a family. You are able to watch your children to eat. You're able to cook a good meal, and it's just engaging in conversation. Turning off the TV during meal times, eating at the kitchen table, not taking their meals to their rooms, or eating in front of the television, because sometimes our brains are so focused on what we're watching, or if we're playing a game while we're eating, that we don't have those hunger, full signals. So that's certainly something we want to be aware of. Keep kids active, just doing chores. Just again, referring to that unstructured physical activity, just having them clean their rooms or helping you with laundry. These are all things that will get them moving. Engage in physical activity as a family. So oftentimes, I know, as a working mom, you're tired, you come home, you really just don't want to do anything. But to get your kids to move, let's go outside and play basketball. Let's, ride our bikes. Let's go for a family walk. Let's do something just to get moving. And of course, going back to TV time, less than 2 hours a day. Now, again, oftentimes this may become difficult, but there are also, we can embrace technology. There's different gaming systems that allow kids to move. So not that I'm encouraging video games, but certainly there are games out there that may be appealing to children that will just get them moving rather than just sitting down playing. So keep healthy, tasty foods and snacks easily available. If there is, Oreos in the house, kids are going to eat them. So trying to keep foods that kids may be interested in and if it's there, then maybe eventually they'll start eating them, but having more fruits, more vegetables readily available. If, whatever's in the home, if it's unhealthy, they're going to gravitate towards that if they're used to it. So trying to just have other snacks that are easily available in the home that they will eat. Certainly avoid buying sugary beverages. It's just empty calories. Encouraging more water is certainly, even adding some fruit to the water to give it a little flavors oftentimes can be helpful. And again, being persistent when offering new foods. So it takes time before kids are going to actually like something that they're not used to eating. So you have to just keep offering it. And again, referring back to my kids, I always offer them things, even if I've offered it in the past and they said, no, I don't like it. If I make it the following week, I'm like, you want to try this? You want to try this? So it's just a good way to get them to broaden the foods that they're eating. Referring back to my plate, learning about portion control. Portion control is a big part of weight management. Involving your children in food selection and preparation. So maybe taking them to the supermarket and giving them choices of things that they may want to try, a new vegetable or a new fruit or, a new protein that they might be interested in. Getting them involved in preparing healthy recipes. These are all life skills that they will take down the road. So, showing them how to cook things, meal prep may be something that would be helpful in a busy family who doesn't have time during the week to cook a healthy meal, but maybe prepping things, cutting up all your vegetables or prepping things ahead of time, and getting your children involved in that. And encouraging kids, I can't stress this more than enough. It's about living a healthy lifestyle. And it's not so much, for kids who are overweight, I always like to stress that we just want you to be healthy and not develop these excess problems that can happen with the weight. So some of the questions that we did get is, what if my child has autism and is a picky eater? So, again, offering new foods, be persistent. Sometimes, again, it takes a few tries, but be persistent and be patient when offering them new foods. Create a schedule and stick with it. So certainly meal times, lots of children with autism tend to be very structured. So creating that schedule, sticking with that schedule, may be more appealing to a child who's willing to try new foods. Praise them for trying new foods. Praise them for sitting at the table when they eat their meal. It may be in a form of some sort of little prize, whether it's some stickers or, something that they like to do. But oftentimes that may help in trying to get them to try new foods. Good mealtime habits. So eating together and modeling these behaviors, modeling that, you're eating your carrots. This is, if we're all eating different meals, then it's like, well, why can you eat that and I can't? So, doing it all together as a family oftentimes can help. And then some children may have issues with certain textures. So, trying to sneak in vegetables and purees and things like that may be helpful with picky eaters. Okay, Dr. Maresca.
So we often get frustrated with our kids when we see them making choices that aren't the best. And unfortunately, sometimes it's beyond our control. I attended a few seminars on mindful eating, and the speaker said that the key to kids developing a healthy relationship with food is to basically let them regulate their intake and make their own food choices, as has been alluded to previously. This was a hard one for me to grasp as a parent and an obesity medicine specialist. However, it really is valuable for kids to learn to listen to their own hunger and satiety cues early on. And by making their own choices, it's allowing them to have a healthy relationship with food. Some things that we as parents need to especially keep in mind are that the amount of control we have goes down as they get older. We can only control so much. We can control what gets brought into the house until, of course, they have money and can buy food. But we can't necessarily control what they put in their mouth. We can set limits, but only to a certain degree. And we also don't want to be overly restrictive. And we don't want to force a child to eat a particular food or amount of food. When it comes to choices, we also need to be realistic and not expect them to make choices that require insight, like choosing broccoli over a cupcake. Some kids may, but the majority will choose the cupcake. So rather than getting frustrated with them for choosing the cupcake over broccoli, maybe present a different choice, like they can choose broccoli or green beans for dinner tonight. And it's not that they can't ever have the cupcake, it's just that they should, in general, have healthy food and occasional treats. And it's important to honor their hunger and fullness. It's important to honor the child's hunger and fullness signals, which change as they get older. So for instance, toddlers, they're not growing as quickly as they were when they were infants, and so they may not have as high an appetite, whereas teenagers who are in their growth spurt may be ravenous. Next slide. So speaking of teenagers, we did get several questions related to teenagers. Teenagers are tough for several reasons. They have increasing independence. They have money. They may be able to drive. They can get their own food. They also struggle with the desire for independence, but with limited insight. So the part of the brain that allows you to make good decisions, the frontal lobe, it doesn't develop until your mid-20s. So it's very common at this age to have conflict with parents for these reasons. Food is social. When kids and teens go out with friends, it almost always involves food in some way or another, and it's probably not the healthiest options. But if you think about it, food is social for all of us. Birthday parties, holidays, family dinners. And it's important to remember that, particularly because we want our kids to develop a healthy relationship with food, this acknowledges that while the primary goal of eating is to provide nourishment to our bodies, it's not always that simple. And then lastly, I've seen a lot of parents get really frustrated because they feel that their child or teen doesn't care about their weight or their health. But I would say that more than likely, they do care. They just might not want to talk about it because it's not easy to talk about. we have to tread a fine line because it is such a vulnerable time in their lives, and we don't want to promote poor self-esteem or body image, but at the same time encourage lifestyle modifications to improve health. So my recommendation is to tread lightly, approach in a non-judgmental and non-blaming way. And the truth is that obesity is a chronic medical illness, and there are multiple factors that go into the regulation of your appetite, how quickly you burn calories, your weight, and even your risk of developing complications. So if we approach them with, hey, look, this isn't easy, it's not your fault, and there's some things we can do to help, that tends to be well received. Next slide. And now to change gears again, what if your child has the opposite problem and isn't gaining enough? So some common reasons why, some kids naturally have a low appetite. Others are on medications that can lower your appetite, particularly kids who have ADHD and are on stimulant medications. So what do we recommend for those kids? You can add fat to food, which adds calories without adding bulk and without making them feel more full when they're eating. Take advantage of times when they're hungry. So a lot of kids will eat a nighttime snack. This is a great time to have a snack because that's when your body is producing growth hormone. So it's providing fuel for your growth. And we recommend a snack that contains carbs, fat, and protein. Also using meal substitutes strategically. Meal substitutes such as Carnation breakfast essentials or other meal replacement shakes are sometimes promoted. I prefer to use these either as breakfast or as a bedtime snack rather than other meal replacements, so that they're not preferring the sweet drink rather than food. But breakfast is a time where you're on the go, you might not necessarily have time, so you can have a quick and easy drink that contains vitamins and protein and fat and carbs. Also, it's also good as a bedtime snack. If they don't have enough time for lunch at school, or if they don't like the food at school, pack a snack or a lunch that's quick and easy that you know that they'll eat. In general, try to avoid filling them up on nutrient-poor foods if possible. And then taking advantage of those times of hunger. So kids who are on stimulants, stimulants often wear off either after school or later in the evening. And so they may not necessarily be hungry for lunch, but make sure they have a good breakfast. And then once the medication is wearing off and they're starting to feel hungrier, a good snack or meal that's rich in nutrients is helpful. Next slide. And then there's the sticky situation where what do you do if one child is overweight and one child is underweight? Or what if one child has specific nutritional needs such as celiac disease or food allergies? So as Dr. Nicoletta had recommended, as much as possible, everyone should be eating the same food. Nobody really needs processed snack foods. I often hear, well, it's not really fair to this other person in the house that so-and-so shouldn't be eating Oreos. Well, the truth is nobody needs to be eating Oreos. And it's not fair to the child who shouldn't be eating Oreos to have it in the house. So as much as possible, try to keep those foods out of the house, and also try not to focus on the differences between the kids. Next slide. And then lastly, we know that there's no way to address every concern in this webinar, so we wanted to let you know about some resources that are available to address particular concerns regarding weight, growth, disordered eating, and physical activity. A registered dietitian is a great place to start. They have registered dietitians in private practice. Also, some pediatricians' offices have registered dietitians, and pediatric endocrinology or other subspecialties may have a dietitian. You can also find a registered dietitian in grocery stores. ShopRite has a free dietitian that you can consult with, and it's great because they can essentially go shopping with you and help you to compare different products and select ones that may be healthier. Your primary care physician is a great person to start with for recommendations if you're concerned about your child's growth or weight. They may recommend that you see a specialist depending on what the concern is. Is there a concern for weight-related complications? I did include here medication. The medications goes way beyond the scope of this talk, but just to bring up that there are safe and effective medications that are used for kids who are having weight concerns, and it may be exactly what your child needs. So ask your pediatrician for a referral to somebody who may be able to help. Adolescent medicine is who we often refer to with eating disorder concerns. So if there's a concern for restrictive eating, adolescent medicine is a great resource. And also patients who have a history of that, adolescent medicine is a great to talk to about advice for how to help with weight maintenance and continue to foster a healthy relationship with food for these patients. Behavioral health, psychology, psychiatry, therapy are also good resources for eating disorders, and there are programs for both overeating and undereating. For physical activity, a lot of gyms don't allow kids under 16, and kids tend to do best with physical activity that is structured. So resources like the YMCA or Boys and Girls Club or your town's recreation program are a great place to get structured physical activity for your children. And a physical therapist can help if you're stuck getting started with exercise, if there's pain or difficulty with movement, a physical therapist can help with that. And with that, I'm going to turn it back over to Allison to see if there's any questions in the Q&A for us to answer.
Thank you so much. That was so helpful and informative. We did receive a few questions. The first one, let's see. How do you walk the line helping an 8-year-old and not making her feel self-conscious about her weight? So I think you addressed this, but if you want to touch on it again.
Yeah, I can take that question. So again, it's really focusing on a healthy lifestyle. So, modeling that behavior with your children is really important. Getting them to be active and moving with them. They're eating the same thing you're eating. This is how we all eat. This is how the whole family eats. So it's really just trying to model that behavior so that they see that this is okay and this is what I should be doing, and really enforcing that it's really about being healthy and not developing problems early on. So it's just really stressing that. And again, it's getting them involved. So getting them involved in the shopping and the cooking, and they may turn to that, and that may appeal to them a little bit more, and you may see that they may change their ways and feel a little bit better about it.
Also, I just want to add too, in terms of modeling, being careful about what you say when you're around them about yourself, and putting forth a positive body image about yourself, and not saying, oh, do I look fat in this, or not saying the word fat at all, trying to avoid that, and just trying to be body positive and focus on health for everyone.
Perfect. The next one is your thoughts on a vitamin to fill the gaps. And an example, they're saying Hiya, Hiya.
Well, I'll say that in terms of specific vitamins, the one vitamin that most kids are deficient in, actually most people are deficient in, is vitamin D. So you want to make sure that unless they're drinking 2 or 3 cups of milk a day, most likely they're not getting enough vitamin D from their diet. So you can even just get a vitamin D supplement. Also, in New Jersey, our water doesn't have fluoride in it. So most pediatricians will recommend a multivitamin with fluoride. So you can talk to your pediatrician, and if your child is of an age where that's recommended, then that has it has your RDA of vitamin D in it, and probably has whatever vitamins that they would need.
Perfect. Where can I find info on meals and snacks for teen athletes before and after workouts? Looking for food suggestions, not shakes or power protein items, just regular food options.
I would probably say a good resource for that would be a dietitian. If your pediatrician happens to have a dietitian in their office, that would be helpful. Sometimes also the schools, some of the, like in some of the high schools, they may offer some dietary counseling and some help with that as well. So that may be something you want to look into within the school itself.
Perfect. There was a question about if this recording will be sent out, and yes, it will be sent out in the next few days. Another question here is, are considerations given for persons of different ethnicities?
I guess consideration, I'm not sure if it's consideration for body mass index or if it's consideration for health complications. But certainly there are certain ethnicities that seem to have higher risk of metabolic complications at lower BMIs. So that can be taken into account. But generally, we recommend screening anybody who has a body weight over the 85th, or sorry, a BMI over the 85th percentile. Once they turn 10 or at the age of puberty, we recommend screening them for diabetes and other complications such as high cholesterol or high triglycerides, fatty liver disease. And so kind of looking at the whole picture is really important.
And it was in regards to BMI.
Yeah, and there aren't any specific BMI curves related to, like, specific to different ethnicities, but we do know that certain ethnicities tend to have you tend to see complications at a lower BMI, particularly for Asian and Indian.
All right, great. The next one we have is, what can I give my child who's underweight and was told his body's too thin for how fast he is growing? He's very tall. Any suggestions?
Who's underweight? Well, definitely for kids who are underweight. So, Dr. Maresca recommended in one of her slides, increasing the fat intake is helpful in those kids. It's more, sometimes some children who are underweight, oftentimes it's difficult for them to eat more. So really trying to increase whatever they're eating, increasing the caloric intake of whatever they're eating at the time. So, if they're eating a burger, like adding cheese or bacon to that burger just to boost up those calories. So, definitely adding more fat in the diet. Certainly, bedtime snacks are good choices because, again, your activity at bedtime, obviously you're not moving, so you may not be that active. So you will be gaining those calories. But definitely focusing on, the meal times when they are eating. What can I add to this meal that may boost up the fat intake and calories? And of course, we always encourage healthy fats and good calories. But that's what you want to try to focus on.
Some specific recommendations I'll give, if they don't have, it's all allergy dependent, of course. Peanut butter is great. You can, if they're having an apple, you can have, or banana, to dip the apple or banana in peanut butter. If they're having a slice of bread, adding butter or peanut butter will add a lot of calories without necessarily adding bulk to it. Adding cheese is also helpful, as Dr. Nicoletta said. Guacamole. The avocado is a good fat. So if they like guacamole, that's a good snack as well.
Great. The next question, are there natural cravings for sweet things in children who independently choose their snacks at school or home? They eat without telling a parent, and is there a way to stop this habit?
I think kids do naturally gravitate towards sweets. And there's only so much you can do. When they're at school, you can't really control what they're getting. If there's a real concern, like let's say they have diabetes, then I would recommend speaking to the school so that you can better regulate what kinds of snacks and drinks they're getting. But beyond that, focus on eating the healthy foods at home, and then, and accepting that occasionally when they're given the choice, they may not necessarily make the best choice, is what I would say. And then talking to the school, if you really don't want them having those sweets at school, asking the school if they, cannot provide it to them.
All right, great. The next one is, what are your thoughts on the recommended number of meals a day? 3, which is typical, or is 5 smaller meals better?
Usually it's 3 recommended meals a day, to maybe 1 or 2 snacks in between. But I also think it's child dependent. If you feel that your child does better with 5 smaller meals a day, especially in a child who maybe doesn't eat well or is trying to gain weight, maybe they just can't consume their full meal. So maybe breaking it into, the course of the day might be helpful, so that they're getting, their full meals.
All right. If anyone has any last questions, please submit it now. Otherwise, we will wrap up. And I just want to thank you, Dr. Maresca and Dr. Nicoletta. This was very helpful and informative. And I don't see any other questions coming in at this time. So I want to thank all of you for taking the time to join us today. Please watch your email for an evaluation of the program. Please take time to fill it out. We'd love to hear from you, and also let us know other topics of interest. The link for the recording of this webinar will be included as well. And we have several other parent forums coming up that we'll hope you'll join us for. The next one is on February 22nd, and it's on, should my child and I get genetic testing? So please visit our website to register and find out more information about these upcoming programs and others. I hope you all enjoy the rest of your day, and thank you again for joining us. Have a great day.
Thanks. Bye-bye.
Bye.